Hi, my name is Debra. I'm one of the advanced midwife practitioners here at our emergency and assessment unit at the Rotunda Hospital. Many of you will know my face from coming in and out, hopefully for good reasons. I work in the unit for the last few years, and I see a lot of early pregnancy patients coming through our department. Most of the time I give some really good news. Sometimes I give some bad news, which can be very, very difficult. So I suppose we see a range of patients from 0 to 42 weeks pregnant. Sometimes we see patients after when they have their babies, and sometimes we see babies for the first 2 weeks of their life. Part of my role is to assess and care for women in early pregnancy when they present to our emergency department. Women present to the emergency room in early pregnancy with complications such as pain, bleeding, and nausea and vomiting in pregnancy. So the non-invasive prenatal testing is an additional opt-in test that can be performed here at the Rotunda. It's not done routinely, and if you feel like you would like this done, you can look up the website or call to the fetal assessment unit for an appointment, and it's usually done between 9 and 12 weeks. I suppose most people will tell their families around the time of the booking visit, but I suppose it's very individualised. There's no wrong or right time to tell your family, whenever you feel is the best time. Some people may need support in early pregnancy to help them get through. If they're having a tough time in early pregnancy, it might be helpful to tell your family, but really that's a very individualised question that is one that you kind of have to answer for yourself.
Hi, Suzanne Smith is my name, and I'm one of the Maternal Fetal Medicine Fellows working here at the Rotunda Hospital. First trimester screening tests are available for any expectant mothers and their partners who wish to determine the risk that their baby may be affected by a number of genetic conditions, such as Down syndrome, Edwards syndrome, or Fetal syndrome. The risk generated from the result of a non-invasive prenatal screening test allows patients and their partners to make informed decisions regarding further diagnostic testing that may be recommended in the pregnancy. The risk of certain genetic conditions increases as we get older, and age may play a part in why some people choose to proceed with first trimester screening. First trimester screening involves an ultrasound scan and a blood test. The blood test examines the level of DNA fragments released from the placenta that are present in the mother's blood. The ultrasound scan allows us to assess that the baby is developing normally. It also allows us to determine the accurate estimated delivery date of your baby, while also confirming whether or not it is a single baby or whether there may be twins or triplets. Yes, there are other first trimester screening tests that can determine the risk of a baby being affected by a genetic condition. These would include the combined test and the quadruple test, which involve the use of an ultrasound scan in combination with an assessment of the levels of hormones in the mom's blood. However, neither of these two tests are as accurate as non-invasive prenatal testing for correctly identifying a baby that is at high risk of a genetic condition.
Hi, my name is Finnegan, and I'm currently working in the Rotunda as the Maternal and Fetal Medicine Fellow. This is entirely a personal choice, and while it's true that genetic abnormalities can increase as we get older, this does not necessarily mean that you need to get testing. It's entirely up to you. So in short, the answer to this question is yes. We frequently will have referrals from the likes of Rotunda Hospital for patients and families who already have a known genetic diagnosis, and we can offer early invasive diagnostic testing if that is appropriate and it's something that you wish to proceed with.